Hey everybody, if you're watching this video, then you're likely seeking some sort of feminization through hormones. My name's Stacy. I'll be your nurse practitioner here at the other clinic. You'll be seeing me live in the appointment. It'll kind of work like how this video does, only live streaming. I'm going to be going over some of the effects of hormone therapy, the different changes that it can cause in your body, the different side effects and everything like that. I know some of you might be already self-educated and this might be just kind of a repeat, but just take it as kind of a general overview. And then if you have any questions, just feel free to write them down, ask me during the appointment so we can clarify anything for you. You may see me glance down every now and again because I have my notes here because I tend to ramble and I'll get off track, so I kind of need something to keep me in line, or else we'll end up being here forever, and everybody's time is important, so let's keep on track. Now then, I'll get started with a disclaimer. The hormone therapy is going to be different for everyone. Nobody is going to develop the same. No one's going to need the same exact doses. Nobody's going to get the same exact side effects or physical effects. Everybody's different. You know, you've got different genetics, you've got different risk factors, everything. So you're going to hear me repeat that a lot, either during this video or during an appointment. Everybody's different. Also, of note, you should realize that a puberty is going to take anywhere from 2 to 5 years. It's not something that's going to happen overnight. So this isn't a race. We're going to develop nice and slowly. That makes it a more natural course anyway. And it also decreases side effects. You know, if you transitioned in 1 year, you would probably go nuts. I don't know. Have a lot of hot flashes and things. So transitioning a little bit more gradually is a good thing, actually. Although I know it'll feel like you want to get it done like right now. But just trust me, it's going to be a process. You'll learn as you go, and you'll be here with me. I'll help you along. So I'm going to start off with hair. In general, your body hair is going to thin out. It won't be as dark as it used to be, maybe. You might kind of lose some of the extra hair that, you know, like is typically male, you know, like the happy trail or something. Although that also might stay. It might just thin out or maybe lighten in color a little bit. The hair on your head, if you had like a balding patch that was slowly getting worse, you might see that it actually either stops or at least slows the progression of hair loss. It generally doesn't regenerate hair, but it can slow the loss or stop it. And Rogaine is a good product also if you want to use up there to try and slow the process of hair loss. Then moving on to breast development, that's a large interest in the trans female population. I know you want to develop breasts. That's one of those key things that really feels like it's identified with, you know, being female. So, of course, everyone develops differently. Again, you may have the genetics to only have very small breasts, like an A cup. You may have the genetics to have a C cup. Who knows? A lot of times it is somewhat difficult for trans women to develop very large or full breasts, but it is not impossible. A lot of times that ends up leading a lot to go and get breast augmentation, which is perfectly fine. You know, if you don't feel like you have developed enough breast tissue on your own, that's a perfectly good option. But I will say that in general, they recommend to give it at least 2 years on hormone therapy to see where you get naturally with your breasts, because then they'll have more tissue to work with. And it's, you know, there's not really much chance of, you know, if you got on the therapy and 6 months later you went and you got breast augmentation done, and then the hormones caused you to continue to develop even after you had the augmentation, and then, you know, you have this implant and your breasts are growing around it, and, you know, things can end up looking kind of funny then. So anyway, if you plan on getting breast implants or something like that done in the future, just know that you probably should be on hormone therapy for a couple of years just to get your tissue up. Let's see. Then moving along, fat. Fat and muscle, rather. So fat-wise, you're going to see that, you know, the thighs, the hips, the butt are probably going to get a little bit fatter. You're going to see that the fat in the face kind of rounds you out. I know I have a nice fat double chin. But anyway, so it'll kind of like soften things. You know, men usually have a more angular, rugged appearance or whatever. So you're going to see that kind of soften out. And Let's see, muscle-wise. So muscle-wise, you usually are going to lose some of that muscle mass. You know, cisgender males typically have about 30% more muscle mass than a cisgender female. So that 30% extra muscle mass over time is probably going to decrease. If you wish to keep that muscle mass, you had better be on a regular exercise routine to help maintain. Let's see, going on to skin, your skin will actually usually soften a little bit and get less oily. You'll be less prone to acne breakouts, and it'll also thin out, which is kind of an interesting thing. You know, you'll see men and women standing there, and the women are all like, oh my goodness, I'm so cold, and the man's just like, the temperature's fine, you know, why are you cold? Well, we have thinner skin, so over time your skin may thin out a little bit. So kind of be aware of that. You know, you might see that like bumping it on stuff might give you a bruise where, you know, whenever you did not have feminizing hormones, it wasn't such a big deal. So it's just something to be aware of that can happen. Let's see, moving on, emotions and personality. So there's this myth that whenever you get on hormones that your personality is going to change or you're going to be a different person. Yeah, that's total crap. What actually happens is a lot of times people either have improvement with the dysphoria that they were experiencing, so improved mood, they might be a little more outgoing because of it, a little more happy, and I mean that does appear to be like a change, but it's not changing who you are. You know, if you loved puppies beforehand, you're still going to love puppies, you know, I mean it's not going to change that aspect of you. It just might make your moods a little different. It can, or at least it's been reported to me from several patients that they're more susceptible to the more feminine type emotions. So say if, for instance, they used to watch, I don't know, a Hallmark movie, you know, something where it's geared toward making you cry, basically. Whereas before they would just be like, oh yeah, that's really sad, you know, and they could feel that it was a sad movie, but they weren't like bawling their eyes out like some of us women do. And after they get on hormones, though, they find they are more susceptible to that. And so they end up crying for the Hallmark movie. And anyway, so I just thought that was kind of an interesting change. And again, that's not a change in your personality. That's just a change in like your moods and whatnot. Because you thought the movie was sad before, but you just didn't cry, you know. So that's not a major change. I don't know where that myth came from, but anyway, not a major change. You may have big mood swings, however. You know, teenage girls have huge mood swings. One minute they're super happy, the next they're screeching at their mom. It's the same thing to an extent with teenage boys as well. But, you know, during puberty, you're getting surges of hormones, you're finding yourself and everything, so you'll have these outbursts. You will have mood swings as well, most likely anyway, but you're going to be coming to them with, you know, an advanced age. You're no longer a teenager. And some wisdom will be in there. So you remember, okay, I'm on hormones, they can affect me this way. So that, you know, if you get in an argument or something, you can just kind of step back and be like, are they really that annoying, or is it just me because I'm moody from being on hormones? You know, so if you find that you're getting into more disagreements or something, just take a step back and just be like, could it be me? Or continue arguing. I mean, you know, whatever. Some people find that to be a good pastime. Anyway, so next, moving on, so sex. Intercourse and libido do change to an extent. So your libido on feminizing hormones is probably going to be a lot less. It'll be suppressed. Some people don't find it's that big a deal. Others, you know, it's kind of a downer because you just don't have that drive anymore. So, I mean, that's something we can talk about through your appointments. Some people like to maintain like a certain level of testosterone in their body rather than minimizing it down to, say, like a level of a 15. They like to keep it around 50. That way they still kind of have that increased sex drive. Completely up to you. We can talk about that in the appointment if you'd like. Just, you know, like I said, write down any questions you have during this video and ask me. Sex itself, you may find that, you know, intercourse is still possible, but you may not be able to sustain an erection that's capable of penetration. You can still ejaculate but it may be, you know, what's called dry, or it may have decreased amounts of semen that come out. That's not to say that you can't get someone pregnant, though. If you have sex with someone with a functioning uterus, you better use protection, or they had better use some sort of protection, because pregnancy can still happen. It is a thing. So be aware of that unless you're looking to get someone pregnant. Let's see. Moving on to the bottom half. Disclaimer, I'm going to be talking about the genitals, so if you have extreme dysphoria with that, I understand if you want to turn the sound down for a minute, but just to let you know, the genitals will change. Your testicles or the balls will get about half their size. The penis, to an extent, the penis will get a little bit smaller, but that's more from lack of those morning erections. You know, that guys will wake up and they have like a spontaneous erection in the morning. You know, over time, being on hormone therapy, you have a decreased frequency of those, and a lot of people don't end up not using the penis for intercourse or masturbation or whatnot, and so it kind of appears smaller from disuse, basically. The only thing I'll mention about that is that if you no longer use it, that skin becomes a little bit less elastic down there, so that over the years, and I mean this usually takes like 10, 15, 20 years, over the years it can become very painful then to get an erection, because that skin isn't as elastic as it used to be. So that's something to be aware of if you're not planning on having bottom surgery, you know, within the next 10 years or anything, that it can actually make things quite painful later on in life if you don't regularly stretch that skin. Anyway, so moving on. Also to mention, for sex, some people say that they discover things that they like that they didn't like previously. You know, they're more open to certain things. So this is kind of a time you can explore with yourself, with your partner, you know, whatever makes you happy. Find out what works for you. You know, everybody's different again. Let's see. Now, in regards to fertility. So this is something you do need to be well aware of. The going thinking is that this will render you infertile. You should assume that it will render you permanently infertile, although there are studies and cases now that are showing that coming off of hormone therapy can actually, you know, for several months, like 6 or 8 months, can revive sperm production and everything, and make fertility possible again. But you should assume it is not going to be possible, so that going into this you're well prepared, because if you want a biological child in the future, then you really should consider freezing some sperm early on in therapy. I know it runs anywhere from like $1,000 to $3,000 a vial to freeze sperm, so it is cost prohibitive to some folks, but it is something that you do need to seriously consider if you really want a biological child of your own later in life. And I know some people that are watching this video are really young, you know, and you may not even be thinking about that now, but it is something, like I said, consider it. Just, you know, I feel obligated to mention it because they don't really have good data out there right now to say one way or the other if this is, you know, permanent and to how much of an extent. So just assume that it is permanent and that it will make you infertile. Let's see. Next, moving on. Other possible side effects. You know, everybody's worried about the side effect of blood clots in regards to estrogen therapy. You know, this used to be a much larger concern because these studies were showing these huge numbers of cisgender women who, whenever they're on estrogen therapy, were getting blood clots and whatnot. And then come to find out it was this particular formulation called ethinyl estradiol that was causing this, that had the higher rate of blood clots associated with it. And we just don't use that now, especially not in trans medicine. Now, some of the cisgender stuff still does use it, but for transgender medicine, we don't use it. That's a big no-no. So we use these bioidentical hormones. And so the theory now is that you do have an increased rate possible of blood clots, which can include, you know, those kind of deep vein thrombosis that occurs in the legs, or up to pulmonary embolism where the blood clot has formed somewhere else and then goes to your lungs. They say you possibly do have an increased risk of that, but what it is actually being that you were assigned male at birth and now you are on female hormones. Females are naturally somewhat more susceptible for blood clots than males are. So whenever you take a cisgender male or a assigned male at birth person and you put them on hormone therapy that's geared toward feminization, what you do is you raise their risk of blood clots to that of a cisgender female, which is an increase in risk for that person, but it's not an increase beyond that of what a normal cisgender female experiences day to day. So the jury's out on what the incidence and occurrence rate of that is. It's just something that you should be aware of, that it is a possibility. I mean, I can sit here all day long and tell you that you have a 2% chance of a blood clot if you go on estrogen therapy, and that sounds like a very low rate, and it is. But if it happens to you, then that 2% number isn't going to matter much to you, is it? But I know I have many of my patients that tell me that the risk is completely worth it because they're so miserable without hormones. They would much rather take the risk. So like I said, that's personal decision. We can discuss it further during the appointment if you have any questions. Also, certain other diseases and conditions that you have could increase your risks, like if you're an everyday smoker, you're overweight, diabetic, stuff like that. So if you want to discuss your individual risks for clots, I can kind of give you a ballpark figure of where I think your risk level is during the appointment. Let's see, what else? Estrogen will likely decrease your blood count. The reason for this is really it just doesn't produce as much or stimulate as much production of red blood cells as, say, testosterone does. So you may see that your blood levels come down 1 or 2 points. And because of that and the thinning skin that I mentioned earlier, it may make you a little more susceptible to cold. So like I said, the thin skin can make you more susceptible to cold. Also, the lower blood levels, not to the point of being anemic, but just lower than you are used to, could make you a little more susceptible to cold. But that, that's not really a huge deal. It's just something to be aware of. If you're ever just like, why am I cold all the time? It's probably because the hormones are working. Also, we'll be doing periodic blood work during your transitioning process. We'll be watching for whatever your individual risk factors are. If you have a strong family history of diabetes, for example, then we may throw in a test for diabetes every now and again to make sure, because some studies have linked estrogen therapy to an increased risk of diabetes, very small increased risk, but it's there nonetheless. And I mean, it's the same with like cholesterol levels. I think it's just nobody really knows much about how these very basic conditions are affected by hormone therapy, because there's just not enough research into trans medicine right now, which is unfortunate, but we're working with what we have. So periodically you might be screened for, your cholesterol levels or something like that as well. Again, depending on your individual risk factors. Let's see, I'm trying to think if there's anything else that I meant to go over that I left out. Let me look on my little list right quick. Not in particular. So whenever you see me in the appointment, like I said, write down any questions you have either from this video or on your own. That way you can get them answered, make you feel more comfortable with this process. If it's the first time you've ever been on hormone therapy, I know it can be like a big leap and you might be excited and scared and anxious all at one time. And, my job is to make you well educated about the process and to be available to you. You can always text me, email me, whatever, any questions that you have in between appointments. I'm here to answer them. If I'm with another patient, of course, it might take me a minute to respond, but other than that, I will get back with you. And anyway, so it's been nice talking to you. Hopefully you found this of some value, and I can't wait to meet you.